Awesome. Well, thanks so much, Pam. I'm just hitting the record button here, so we should have that going. For a couple people that came in just very recently, this would be a good time if you have the ability to get to it to get some kind of measuring device like this. This is just a tape measure. This is something you might use to measure cloth or something like that. If you have one of these in the house and you know where it is, this would be a good time to be able to get that because I'm going to put it to use. I'm going to teach you tonight how to quantify your breathing. So a lot of times when I talk to people or I ask them a question, what kind of breather are you or how do you breathe? I get a very blank stare to that because it's hard to quantify. We might think we breathe well, and maybe we do, but if we don't have a way to be able to objectively measure it, it's hard to necessarily know. So I'm going to teach you a method to be able to do that. But as long as you have that, that's great. If you don't, we'll send this out, I think, on a video as well, so you can watch it and maybe follow along also. So thanks for being here tonight. I really appreciate you taking the time. My single goal tonight is really to serve you. So you're choosing to watch this instead of another rerun of Two and a Half Men or something like that. So I appreciate that. And my goal really is to serve you this evening. So what we're going to talk about is first why and how we should be focusing on our breath. So you can do breath work at any sort of different cadence that you want to. We'll talk about different things like box breathing or coherent breathing or resonant frequency breathing. And those can be really good things, but unless you know how to breathe properly, unless you have the proper mechanics for your breathing, I don't think you're going to get the most bang for your buck out of those practices. So, Pam made me promise that I was going to go light on the physiology and heavy on the experiential, but I have to do a little bit because I want to make such a compelling case to you about why it matters how you breathe. So there might even be a little math involved. You're off the hook. I'm not going to call on you for anything. It's all laid out. But I want you to walk away from this presentation really having a good sense of why this is so important, how you can make changes potentially today or tonight, and make changes over the course of the next days, weeks to months, however you choose to do that. But then also a few other practices that you can do within the realm of breath work that you can access any point that you would want to. You can do them in the car. You could do them waiting at the DMV to get your real ID. You could do it while you're waiting for your corn or Pronto Pup at the state fair, and there's a lot of people around. However you want to do it, however you want to use it, but it's free to be able to do these things, and you can use them as needed. So what I'm going to do is share my screen. I've got a PowerPoint that I want to, there we go. All right. Can everybody see that? Can you give me a thumbs up in the camera if you can see that? Perfect. Okay. So you can see the title there. I love this quote from Dr. Andrew Weil. If you don't know who that is, he's got the bald head with the white beard. He's had a white beard probably for 3 or 4 decades, but he's been in around integrative medicine and complementary medicine for a long time. If he had to limit his advice on healthier living to just one tip, it would be simply to learn how to breathe correctly. And that is what I'm going to teach you tonight. So how should we breathe? Is this a good way to breathe? Is this a good way to breathe? We got, I don't know what this would be called, the huff and puff. We've got lots of rise and fall of the shoulders here, a lot of mouth breathing going on. Or belly breathing, is that a thing? Is that what we should be doing at all times? Or one of my favorites, whatever this is, no sound, but hopefully you can see through that. So we're not going to go any nipple breathing tonight, but I'll show you how to do some more physiologically functional breathing. So first thing we have to talk about is a little bit of anatomy and a little bit of physiology because I really just want to drive this point home for y'all. We're going to divide the respiratory tract into two groups. We have an upper respiratory tract, that'd be your nose and your trachea. We could talk a whole session just about nose breathing. And all I'll say about it is you ought to be nose breathing. If you're not, it's a detriment to your health, whether it's during the day or at night. But we're going to leave that alone just for the moment. The other part of the respiratory tract would be the lower respiratory tract, and that's what we're going to talk more detail about. So if we look at this picture, what I want you to appreciate, we have this vertical tube coming down. That's where the air is coming through, and then it's going to start to bifurcate. And honestly, it's kind of like a tree, an upside down tree. So you've got the main trunk, and then you start to get major branches coming off of that. And then each of those little branches start to move out, and then eventually you have leaves. So, what's really important to understand from this particular anatomy is that we have something called anatomic dead space. We all do. If you have lung diseases, you probably have more, but everybody has some amount of anatomical dead space. That just means that's air in your system that is not participating in gas exchange. So we'll talk about the difference in air that comes in as a total and air that comes in that actually gets to participate in the gas exchange. But I want you to remember, plant this seed right now. We have this anatomical dead space. Each of us do as adults here, and it's about 150 milliliters. Now, if we continue to follow the bifurcation out into the smaller branches, we go into what are called bronchi and then bronchioles, and then eventually we get to this place that's called the respiratory zone. And what we see here is this is where the alveoli start to be able to form. Now, alveoli, if you've not heard of them, those are the units within our breathing system, our respiratory system, that participate in gas exchange. So it's taking the oxygen from the air that we breathe, which oxygen is only a small percentage of. Actually, most of the air or the primary molecule in the air that we breathe is nitrogen. But these alveoli take the oxygen from the air that we breathe, send it into our system all the way to our heart that it can start to send out to the rest of our body. And then when we exhale, the alveoli are participating in that gas exchange to help get the CO2 out of the system. So much more complex than that. I could talk at length about that, but just remember, I guess, from this slide that it's the alveoli that we're primarily concerned with getting the air to. For adults, there's about 2.5 to 3 liters of gas in both this transitional and respiratory zone. All right, so if we look at alveoli a little bit more closely, they're kind of like a clump of grapes. So if you can picture that, that's what our alveoli look like. They're kind of these little grape-like ball things, and they're enmeshed all around by all these different capillaries. So a couple really interesting facts, I think. So we have about 500 million alveoli in our lungs here, and each of you do as well. Just to put that into perspective, it's estimated that there's roughly about 343 million people in the United States right now. So you've got more alveoli in your lungs than there are people in the United States. And if you go to the state fair on a crowded day, that's even not more impressive because probably half of those people in the state of Minnesota are packed into a very tight space. Now, what's also pretty staggering is that each of those alveoli, each of those 500 million alveoli, they're enveloped or wrapped around by this pulmonary capillary network, of which there's 280 billion. So to put that into perspective, if you took a football field, a lush green football field, which nice little blades of grass all around it, there's roughly about 8 million blades of grass in one football field. I don't know who counted that, but that's what AI told me. So I'm sticking with that. But if you wanted to get to 280 billion, you would need 35,000 football fields. And if you put all of those football fields next to each other, back to back, that would cover the entire city of Minneapolis and bleed over into the surrounding suburbs. So right now, as you sit, you've got that many pulmonary capillaries within your system. Pretty staggering. Now, to talk about the size of the alveoli, they're about 250 microns across. To put that into perspective, a piece of paper, if you look at it from the thin side of it is about 100 microns across. So it's about 1.5 times the thickness of a piece of paper. But the blood gas interface is only about zero point 0.2 to zero point 0.3 microns thick. So incredibly thin and potentially fragile when we have, airborne toxins or different things in our system. And then lastly, it takes about 0.75 seconds for a red blood cell to cross the capillary network. Or to put that into perspective, that's about the same amount of time that it takes for my son to give me an eye roll when I ask him to do the dishes. So it's very fast. He's very fast on the eye rolls. Let's talk about a couple of definitions if we can. So breathing, how would we define breathing? It's simply the mechanical process by which contraction of certain muscles is going to move air into and then out of the lungs. Further, we can divide that into what's called ventilation. So we have two types of ventilation, and bear with me here. Pulmonary ventilation is simply the amount of air entering the lungs in a given period of time. Usually we'll measure that over the course of a minute. So we'll have measurements called a minute volume of air. So we'll typically measure that in liters. Contrast that to alveolar ventilation. Now, that's the portion of ventilation that participates in gas exchange. Remember from a couple slides ago that you've got 150 milliliters roughly of anatomical dead space. So pulmonary ventilation doesn't care about that dead space, but alveolar ventilation does. And why that's relevant to you is that's what is important to be measured. That's the amount of actual gas exchange that's going to be happening. So how we calculate alveolar ventilation is we take that tidal volume, so the total amount of air that's entering the lungs in a period of time, and then we subtract the dead space, and then we multiply by how many times a person is breathing in a minute. So I'm going to do a couple calculations here because I think it's important to illustrate why the way we breathe is so important. So if we think about shallow breathing, so first of all, let me back up. What I did here is I kept pulmonary ventilation consistent between all of these three different scenarios. That means it's the same amount of air that's entering the lungs within a given minute of time. But we're going to see based on how you breathe, how that's going to change the alveolar ventilation. Remember, that's the amount of gas exchange that happens. So in order to calculate the pulmonary ventilation in this case, we've got a tidal volume, so that's the amount of air that's entering the lungs in a single breath. We multiply that by 22 breaths, and that's going to give us a 5,500 milliliters a minute of pulmonary ventilation. Now, if we want to calculate alveolar ventilation, however, remember we need to subtract the dead space, the anatomical dead space. That's that 150 milliliters that we're subtracting. We multiply the same number by the same number of breaths per minute, and that puts us at 2,200 milliliters a minute. So less than half in this scenario of the air that you're breathing in is actually participating in the gas exchange. So that's when you're doing sort of rapid, shallow breathing and why it can be so helpful to slow breathing down. Let's talk about normal breathing. So another scenario. Here we have a tidal volume of 550 milliliters. We're going to multiply by 10 breaths a minute, which is a little bit on the shorter side. The average breaths per minute is probably about maybe 12 to 18, maybe 10 to 18, somewhere in that ballpark. Some people are a little higher, some people are a little lower. But if we keep the pulmonary ventilation consistent, we're going with 10 breaths per minute. Now, if we do that same calculation as before, so we subtract the dead space from that, now what we find is that we've got 4,000 milliliters a minute that's participating in gas exchange. So again, the same amount of oxygen or air that's entering the lungs in a minute, but now you're getting almost double the amount of oxygen exchange by breathing just in a slower manner. Lastly, let's show what happens when we have deep breathing. So for that, let's say you're only breathing 5 times a minute. That'd be a really, really slow breath, but we'll talk about this particular style of breathing later. So you're taking a bigger breath typically in this context. Now, if we subtract the anatomical dead space from this, that 150 milliliters, we multiply by 5 breaths. Here we have 4750 as far as the amount of gas exchange that's happening. So what I want you to take home from this slide, again, is how you breathe matters. The pace that you breathe matters. And I'm going to talk to you about some different slower paced breathing practices. But what's critical is that you also have the proper mechanics for breathing in the right way. Hopefully that makes sense to everybody. So I like this little video here, and what you're going to see is just a kind of a shallower breath and then a bigger breath. And you can just see how the whole mass of the abdominal organs is descending during the inhale. What you can't see is the main muscle that is doing this work. There are 3 primary muscles of breathing, but there's one that's dominant. And you can probably think of it in your head right now. It's called your diaphragm. So it's kind of a weird looking muscle. It's hard to picture sometimes, but I will occasionally use, think about a vegetable steamer, and if you were to put it upside down. So your diaphragm can go all the way up to about your fourth rib. And then as you inhale, your diaphragm is going to descend towards your pelvis. As it does so, it compresses the abdominal organs and it pushes the ribs out to the side. That's normal behavior of the diaphragm. If you're doing shallow breathing, you are not using your diaphragm appropriately. So that's the main role from a breathing perspective. But the diaphragm has a whole host of other functions that it does as well. Very helpful for core stability and postural control. I would say necessary for those things. So if you're a person sitting there and you're thinking, boy, I'd like to do a little bit more with my core, I could benefit from greater core strength. I would strongly encourage you to pay attention to some of the breathing stuff that we're going to do, because you can think of your core kind of like a soda can. So as long as that can is intact, you've got a top, bottom, and sides all the way around, it's very strong. You could hand me that can and I would not be able to crush it. But if you open that top even just a little bit, you could hand that same can to a child and they can crush it. It's because they're not able, the can is not able to maintain the pressure that's within that can at that point. The thickness of the walls is the same of the top and the bottom, but it's all about that pressure piece. So just putting a plug in, this stuff is really important also for people who are athletic and you want to just have a better overall functioning core. Very synergistic with the pelvic floor. I often say that the diaphragm and the pelvic floor are like dancing partners. So as you inhale, the diaphragm descends towards your pelvis. Your pelvic floor ought to be able to allow or accommodate that descent. And then as you exhale, both of those ought to move back superior again or up towards your chin. So if you have any issues with pelvic floor health, whether it's incontinence or pain with certain things, making sure that you can breathe properly and especially using your diaphragm properly becomes really critical. Important for venous return to the heart, for fluid fluctuations in our cerebral spinal fluid, coughing, sneezing, vocalization. So a whole host of things that the diaphragm is going to do. Now, one of the muscles that is not part of our normal breathing pattern, but I see very often, is a muscle called your sternocleidomastoid. Sometimes you'll hear it called just your SCM. We don't need to go into the attachments all that much, but anybody seen this before? Somebody who takes a nice big breath in, but holy buckets, there's a whole lot of neck involvement there. You can almost see how that muscle's like lifting up her rib cage. That is an abnormal situation. So there are muscles of our neck that need to be active to a little bit, but I'm amazed when I ask a person to take a deep breath in, almost always it becomes this vertical thing that happens. If you remember one thing from this presentation, remember a good inhale should be a widening of your rib cage, and a good exhale should be a narrowing. So if you want to channel a slim, thin waist, do it on the exhale. If you try to do it on the inhale, you are going to be fighting yourself. And a lot of people mistakenly think they're helping their core or get stronger, or they're helping back pain or whatever by keeping tension in their abdomen all day long. And I can tell you, you're not. There are times when you need to have tension in your abdomen, but you also need to be able to let it go, just like the pelvic floor. So make sure that your inhale allows for a relaxation of those muscles so that you can widen, and that your exhale becomes a narrowing. So there's a few different causes of dysfunctional breathing. We're primarily going to be talking about biomechanical causes today. There certainly are biochemical as well, and then psychological, but we're going to keep it pretty narrow in our focus for this evening. So a couple things as a clinician that I look out for. If you see anything on this list, this might be a clue to you either for yourself or maybe a loved one that you could stand to do a little bit of work on your breathing. So anything from anxiety to burnout to any sort of dysautonomia stuff. It could be Parkinson's, it could be POTS, it could be long COVID stuff, heart disease, asthma, of course, COPD, of course, any sort of lung related stuff, but a lot of gastrointestinal stuff as well. People with IBS, constipation's a big one. So I will often see people who are constipated and really constipated. I mean, I've worked with people who've had one bowel movement in a month before, and you think to yourself, how is that possible? But it is. So if you're only taking a poop every 2 or 3 days, that's a problem. Your body is not getting toxins out as well as it could. And it's possible that dysfunctional breathing could be an element to that. So here's what I want you to do to begin with. Most of your screens are off. That's all good. No worries. We're going to do this little high-low breathing assessment. So this slide is from a whole video course that I put together primarily for clinicians. It's 11 and a half hours long, so I've got plenty of stuff to talk about. But I'm going to just have you do this because it's going to be relevant for what we get to in just a little bit. So what I want you to do is you're going to rest one hand just in the middle of your sternum, just as you can see I'm doing in that picture there, and you're going to rest one hand on your abdomen. And all I want you to do is just breathe normally. You don't have to take extra big breaths. You don't have to slow them down, but just breathe normally. And I want you to just answer this question for yourself because, again, most of your screens are off, so it's just you doing this on yourself. Which hand is moving more? Is there a dominant hand? Are they balanced? Just take a few breaths and feel what you feel. Now, normally, if I'm able to be in the presence of somebody, I'll be able to watch them as they're doing this, and I'll be able to get some pretty good information. So, spoiler alert, most of you probably know this, the majority of the movement should be down in the bottom hand. So it should be the hand on the tummy. One of the helpful things that I think you could try if you're interested is to do this in front of a mirror. If you see any rise and fall of your shoulders, you're what we would call a vertical breathing pattern. If you feel a lot of movement in your upper hand as you're inhaling and exhaling, you would have that vertical movement pattern. If you see any activation of your neck, you would have a vertical breathing pattern. This is super common. If you appreciate this and you start to look around next time you go to church or you look around at the grocery store, whatever it is, you'll see people all over the place who are having and demonstrating this vertical breathing pattern. If you look at babies and young kids, they breathe perfectly for the most part, but leave it to grown-ups to muck up a perfectly good system. So ideally, we want to have more of what's called a horizontal breathing pattern. And that's where you would have more, if not the majority of the movement happening in your abdominal hand. Now, most of the movement that we will typically feel is into our abdomen. And that's simply because we don't have ribs there. However, A truly good breath should be 360 degrees, which means there should be some widening of your ribs when you inhale, and even the ribs in the back will move away a little bit. So it's like this circle getting bigger on your inhale, and there's no rise and fall of your shoulders. I showed you a couple of videos of that one guy who was kind of huffing and puffing and doing a lot of mouth breathing. That is not an ideal or efficient way to be able to get oxygen down to where you need it to be, down to the place of the alveoli. So now what we're going to do is we're going to put what you just recorded on yourself and we're going to put it into a calculation. This is called the breathing IQ, and this was developed by Dr. Belisa Vranich. She's written a couple books. Breathe is one of her books, not to be mistaken for Breath, which is a book by James Nestor, but she wrote Breathe. And then she also wrote a great book primarily geared towards athletes and making the case why athletes should care about breathing, called Breathing for Warriors. But there's two components to this breathing assessment here. So the first component we've essentially just done. So you are taking a qualitative measurement and you're going to categorize yourself in one of three ways. You're going to be a vertical breather, which means that the majority of the motion you felt was in your upper hand, or there was a definite rise and fall of your shoulders, or there was some neck involved. That would be a vertical breathing pattern. I would say most of the people that come in to see me in the clinic, unless they've previously been trained by a vocal coach or they're a former musician or of a wind instrument, I should clarify, or I've seen them in the past, are going to be vertical breathers. You can be a mixed breather, which means you do some vertical, you do some horizontal, but it might just kind of depend on where you are. Or you could be a horizontal breather. Very rare that somebody would come in and see me in the clinic and be a horizontal breather. But what I'm going to teach you tonight, or at least try and make a compelling argument, is for you to try and strive to be a horizontal breather, because that's where you're going to be able to get the diaphragm to work best for you. So you have a stronger core, your pelvic floor will work better, and all the other breathing practices that you're going to do that I'll show you will be more effective for you. So it starts with mechanics, and then we can start placing it into different boxes as far as how we're going to be breathing. So once we have our classification, then we're going to need to take a quantified measurement. So what you're going to do, hopefully some of you grabbed a cloth tape measure that you'll be able to use. The landmarks that you want to reference, middle of your collarbone, if you cut your collarbone in half and you come straight down to your rib cage, that's where you're going to line this tape. So I'm going to back up just a little bit so you can see me a little bit better. So I'm going to align the tape measure. If you have one, please go along with me here. So you align it to the bottom of the rib cage. You want to make sure that the tape measure is horizontal, where it's just straight across and it's not dripping down in the back. And then what you're going to do is you're going to take a full, big, deep breath in, big as you can. And then you're going to take a full exhale, breathing out all the air that you possibly can. And then we're going to do a little calculation. So I'll do this and we'll calculate my score together. So I'm going to take my inhale. I'm at 35 and 3/4. And then I'm going to do my exhale. 32 and a half. 35.75. 32.5. So what we're going to do then is we're going to take that number and plug it into this calculation. Look down below, you can see inhale minus exhale divided by the exhale, and then we multiply 1,000 to give a percentage. So I'm going to do this calculation in real time. So I'm going to take 35.75. I'm going to subtract 32.5. Then I'm going to divide that by 32.5, and then I'm going to multiply by 1,000. That puts me at 100%. So if I were to classify myself as a horizontal breather, which I would, you can see on that little grid towards the top of the box, the very bottom x-axis, I suppose, you can see the percentages that are marked out there. So that would put me in the A category. So hopefully that makes sense. If you're a vertical breather, even if you got 100% on that x-axis, the highest you'd be able to get on that letter grade would be a C. Hopefully everybody sees how that works. I'll open this up for some Q&A at the end. So if you're confused about it or don't understand how you would get to the letter grade or how you do the calculation, you can just save that question and I'll try and dial it in. The other thing you could do, I put a link there at the bottom, www.mybreathingiq.com. That's Dr. Belisa's website. If you just go there, you plug in your inhale and your exhale, it'll do the calculations for you. It'll ask some information about height and weight and email and all that stuff, but you actually don't need to enter it in. I'm sure she'd love for you to do that, but you can just kind of skip right through and get to the letter grade if that would be helpful for you. I think it's a really important number to be able to have. I think everybody ought to know their VO2 max. I think everybody ought to know their letter grade in the breathing IQ, the same way that we know the amount of money that's in our bank account, because it will matter to us at some point in time. So now, as far as making some changes, what I want to talk about are a couple of exercises that I might give to people who are not at that A level yet. So it's again very uncommon that people who are untrained would be at that place. So I hope you do take the time to do this calculation for yourself. You don't have to share it with anybody, but this would be a number for you to be able to know so that you can make some progress with it. I would assume that is probably a goal to be able to do. So one of the first things that I'll do with people is I'll have them come back to this high-low position. And I will typically have them start on their back. So lying on your back is typically going to be easier to breathe because your diaphragm does not have to do any of its normal postural work. So it can just totally focus on the breathing aspect versus when you're upright, such as I am right now, is my diaphragm has to some degree also stabilize my spine. So it has to do double duty. So often starting on your back, resting one hand in the middle of your sternum and one hand just on your abdomen, your goal is to try and have all the breath go down to your bottom hand. So if I was turned to the side, the goal would be all of the movement would be happening down here in my abdomen, both with the inhale and the exhale. During the inhale, my belly button will move away from my spine. During the exhale, my belly button will move closer towards my spine. Notice there's no movement happening up here. And a lot of people will ask me, how is it possible that you're not going to get any movement happening up here? Because the air's coming from above down. Isn't it normal that your rib cage is going to expand on the inhale? And to that, I would say, think about pouring water into a cup. You're going to have that water come down through the top of that cup, but where does that water fill? It fills up from the bottom. That's the same way we want to breathe. We want to fill up from the bottom up. Most people are spending time essentially breathing all up here, and there's a strong correlation between things like anxiety, neck pain. I had a lady that I saw a couple years ago. She was a nurse, awesome person. She came in, was having all this neck pain. I could see right away that she was a very vertical breather. And I mean, you could see it in her neck. It's like her neck was actively working to help her breathe. And I showed her what I was finding, and she was into it. I spent probably 4 to 6 visits at our PT clinic at Creekside just working on breathing. After those 4 to 6 visits, whatever it was, her breathing had substantially improved and her neck pain was 80% better, 80% better. I didn't touch her neck. I didn't give her any stretches. I didn't give her any strengthening. I didn't do any sort of fascial work or any sort of work on her spine at all. It improved by 80% just by changing how she breathed. So that doesn't mean all neck pain will get better by learning how to breathe better, but it's amazing how often I see dysfunctional breathing coincide with neck pain, just as an example. Same thing with back pain, jaw pain, even things like shoulder pain. So if you have pain in your body, making sure that your mechanics are dialed in is a really, really important thing. So we start in that lying on your back position. You get to a place where you can comfortably inhale and exhale predominantly through the belly. Then your next challenge, the next level of difficulty is to do it upright. Most of you are sitting upright right now, I expect, I don't know. But then the goal becomes to be able to keep all the shoulder muscles relaxed, all the chest muscles and neck muscles relaxed, and just breathe. I often encourage people to do it in front of a mirror. Your eyes won't lie. You'll often feel like you're breathing predominantly in your belly, but when you see yourself, use the landmark of your shoulders and notice if there's any rise and fall that's happening there. If there is, you're vertical breathing. Your goal is to get to horizontal breathing because that's where you're going to be able to take more advantage of the alveoli to be able to get that good gas exchange, and your diaphragm is going to work better. So that's your goal with that. Then eventually getting to standing. And once people can get to that place, then we're going to add another element to it. If you remember, I talked previously that we don't just want this forward and backward motion of our belly. We also want 360-degree motion, including the sides of our rib cage and our back as well. So then what I'll often have people do is just breathe normally, breathe relaxed, and focus on just feeling, first of all, is there any widening of your rib cage on the inhale and any narrowing of your rib cage on the exhale? Hopefully there is some. When I work with people on core strength, it becomes critical that that individual is able to widen their rib cage on the inhale and narrow on the exhale. We're not getting into core strengthening stuff today, but suffice to say, that becomes your next goal. You want this 360-degree breath. So one of the tools that you can use is a TheraBand. Many of you have these kind of stretchy bands, or they're certainly not expensive to get. And what you can do is you can tie it around your midsection, lower ribs, I should say. Let me clarify. So I'm going to tie it around. Ideally, you keep it nice and flat because if it starts to get narrow, then it's going to be less comfortable. I'm going to keep my arms up here just so you can see me a little bit better. So your goal becomes with this band in place that you, during the inhale, can expand into all elements of that band, forwards, sideways, and into the back. When you exhale, you should feel like you're decreasing the tension in that band, almost like you're getting to this narrow point here. So what's beautiful about this is you can put this on underneath your clothes. So nobody's got to know that you have this on at all. A great exercise for a lot of people would be put a band on and then go for a walk. However far or fast you want to go, it doesn't matter. But what's beautiful about this band is it serves as just this little bit of cueing so that it keeps you thinking about breathing in that 360-degree way. If you're doing a really good job breathing circumferentially like that, you're probably not going to be a vertical breather, and a lot can potentially change for yourself. That same nurse that I talked to you about that made 80% improvement just by working on her breathing, this is something she would put on under her scrubs. So she'd put it on, she'd go to work, she'd be documenting in the hospital room, and it was just this little bit of cueing that kept this pattern going. Because one of the tricky parts is when your mind gets occupied by something, whether it's work or you're in a heated conversation or you're driving, is your breathing pattern will often change. So doing something like that can often help to get you to a place where you're breathing more consistently in that 360-degree way. Now, this is that book I referenced earlier, Breathing for Warriors by Dr. Vranich. I'm not going to go over these exercises. These are often exercises that I will put into a person's treatment plan in the clinic to help them get to an A on that breathing IQ. But I don't know people's health history on this, so I'm not going to be having people do these different exercises because you could have stuff that maybe isn't appropriate for this. But if people are interested, you can get this from the library. Hennepin County Library's got a couple books that you can check out or obviously buy it. I'm sure Dr. Branch would love if you did buy it. That'd be great for her. But these are books, these are exercises straight out of that book. So I will typically use those in the clinic. So that's the mechanical piece. I'm going to just hold off on any questions till the end. If you have a question at this point, please write it down or just remember it. I'll be happy to answer it when we get to the end portion, to the question portion. So once and only once you are able to start to work on proper breathing mechanics, then I think it makes sense to be able to start to plug in that breathing pattern into different strategies, if you will. So we can use breath work as a tool to feel more calm. We can use breath work as a tool to feel happy, to feel at peace. We can use breath work to get our energy up. We can use breath work to help us go to sleep. There's a lot of different ways that we can use breath work. There's no way we could cover all the potentials just in this little happiness hour, but suffice to say, there's a lot of things that you can use it for, but remember, your mechanics or how you do the breathing is a critical aspect. So typically what I'll do is I'll start uh, whatever time it takes. Maybe it's a one session, maybe it's a couple weeks to make sure that somebody's breathing mechanics are dialed in first. And then I will start to add some of these things that I'm going to share with you now. So we're kind of speeding ahead of what a normal course might be for an individual, but maybe some of you at home are at an A and you're ready to move on to some of this anyway. I have a person in the clinic that came to see me. I'm working with her currently, and her primary complaint is feeling like her nervous system is not able to regulate. And she asked, could I help her? And I said, maybe. These are the things that I think I can do that could be helpful. And a lot of what we've done in our first 3 visits has been working on her breathing pattern. So the first thing that we worked on, just like we did tonight, is we identified where she was. So we took the breathing IQ so that we'd have something to be able to track. And then we made sure that her consistent pattern was that 360-degree breath, which I would encourage you to do as well. And then we started to layer on a couple of these other things. And she said to me earlier this week, she said, I'm really glad that we took the time to dial in the breathing mechanics first because I feel like I'm getting so much more out of these other practices. That's what she told me. So that's again why I have intentionally put this in the sequence that I have. So my encouragement for you, get your breathing mechanics dialed in first and then start to explore some of these other things. The first thing that we're going to explore, this is if you were to type in on YouTube, oh, there you can see it just a little bit. So this is a paced breathing practice. This is called 5.5 breaths per minute. So there's something kind of magical that happens in oscillating systems. And that oscillating system could be our breath, our gastric motility, a jump rope, a pendulum, a swing, anything that oscillates has what's called a resonant frequency. And the easiest way for me to describe that to a non-physics major is think about using a jump rope, especially if there are 2 people on the end of that jump rope, like double dutch or something like that. Think back to the playground. When you first start to spin that rope, there's a lot of effort that's involved, and it's kind of clunky if you're not quite synced up to the right rhythm. But there's a point where you reach this sweet spot of that jump rope, and it becomes essentially the least amount of effort to put in that creates the maximum amount of height within that jump rope. The same thing happens in any oscillating system. That's called resonant frequency. Now, it just so happens that with humans, our resonant frequency, depending on the person, is somewhere between 4 to 6 breaths per minute. So often it's said that taller people will have a little bit of a smaller resonant frequency, so they might be more like 4 breaths per minute, whereas a shorter person might have more breaths per minute. So there's this magic that kind of happens when we're in that place. And it's not like every oscillating system in your body syncs up, but it's like they all kind of click into place and they're all working a little bit more optimally at their own unique rhythms. So we're going to do this here in a moment. For those of you that might be interested in exploring this in the future, just go to YouTube, type in 5.5 breaths per minute, and you're going to probably find this video. This is from BYU Biofeedback, and there's nothing to see on the screen. You're going to hear a chime, and we're going to do this together probably for about 5 minutes or so. The video is 10 minutes in length. If you wanted to do a different breath cadence, you could do that. You could type in 7 breaths per minute or 8 breaths per minute if you found this to be challenging, or you could do a smaller breath per minute, so maybe 4 breaths per minute or something like that if you wanted to. But it seems from a lot of the research that 5.5 breaths per minute is the sweet spot for most people. So you can certainly get fancy biofeedback to see exactly where you as an individual need to be, but dollars to donuts, you're probably going to be pretty darn close to this 5.5 breaths per minute. So at this point, we're going to go through this practice here. There's going to be a little chime that ascends. So the notes are going to go up. At that part, you're going to inhale. Then the chime is going to go down. During that part, you're going to exhale. There's no holds involved with this. So some people will ask me about things like box breathing that includes certain holds, both on the inhale and the exhale. And if you know that you're a person or suspect that you're a person who might hold your breath frequently throughout the day, especially if you get really into, a project or an email or something like that, probably starting with box breathing is not a great option. You want to have something that's going to continuously have you inhaling and exhaling so that you can get out of that pattern of breath holding. So once again, I'm going to hit play here for a moment. If you're sitting, you can sit. If you want to go hands up top and down below, you can certainly do that. So you can practice two things at one point in time. Or if you want to lie down, you can do that too. This would be a great invitation or an opportunity for you to lie down on a couch. You don't have to be on screen. You can lie down on the floor, lie down on the bed, whatever you happen to be doing. We're going to go for about 5 minutes here. And then after we do that, then I'll kind of bring it back together and talk about a couple of other things. But if you're ready, here we go. Balancing type of breath that you can do. Always making sure that you're using the right mechanics, as we've talked about already, but now we're stacking this piece on as well. Now, what's cool about this is you can, once you get this breathing pattern down, this 5.5 second inhale, this 5.5 second exhale, then you can also start to stack some other things on top of it as well. Some people don't have a great history when it comes to breathing, either related to some trauma that they had or near drowning experiences or suffocation, different sorts of past experiences. So breathing sometimes is very uncomfortable. And so there becomes this negative association that's created with it. So the more that while you're doing these breathing practices, you can also channel feelings of gratitude. Sometimes I'll have people put an essential oil kind of in the room, just a nice fragrance that they appreciate, that's calming as well. So you can start to stack other feelings as well. That's really helpful for the vagus nerve and just getting the body to be able to reset. So we're going to move on from that because there is a practice that I want to show you. See if I can get to my, okay. So if you were to do that type of practice, how often would you do it? Well, this systematic review found that at least 6 sessions over at least a week was associated with stress reducing benefits. And the authors also found that practicing for at least 5 minutes seemed to make a difference. Whereas if you practice for less than 5 minutes, probably not as valuable for you. So again, you could plug that in the morning, in the evening, on a lunch break, oftentimes can be really refreshing. Um, Doing it on the car ride home or when you're stuck in traffic, as it seems like we're always stuck in traffic now because every roadway is under construction. I think in the entire Twin Cities, this can be a very helpful thing to just get you to a better place. These are some additional styles of breath work. I'm not going to cover all of these things because we're getting close to our hour and I want to leave a little bit of time for questions and clarification. But one of them that I am going to talk about is what's called the physiological sigh. A lot of people have heard about box breathing. Triangle breathing essentially is just an inhale, exhale, and hold, or an inhale, hold, and exhale. You choose the time interval that you want to do with that. 4-7-8's very popular. Inhale for 4, hold for 7, and exhale for 8. Dr. Andrew Weil popularized that one. But the point is, it's kind of infinite as far as what time interval you choose. What I think is more important is that you have really good mechanics when you do it, and you find a particular rate or pattern that's going to be really helpful for you, meaning that it feels good to do. So try some different ones. Again, I encourage you to try that 5.5-second breathing. It's really simple. It's really nice to be able to do. But I want to talk about the physiological side. So some of you have heard of Dr. Andrew Huberman. Some of you, I suspect, have not. He's kind of a rock star of a academic these days. He works at Stanford doing some teaching, but he also has this podcast called the Huberman Lab Podcast, and he's sort of launched into rock star status in the science world. So he was on this paper. He wasn't the main author, but I think it became popular because his name was attached to it. And what they did is they compared just doing sitting meditation, not thinking about breathing. They then had people, one group do physiological sigh, which I'll share what that is. One group do box breathing, only 1 second intervals with that. And then they had a group doing sort of this fast-paced breathing followed by a hold, which is kind of like Wim Hof breathing, if you've ever heard of that. And they compared them. They did 5 minutes a day for 1 month. What's beautiful about that is all of the groups, every single one of the groups had improvements as far as stress levels, anxiety. They reported improved mood and affect. However, the physiological psi group had a higher increase in positive affect compared with the mindful meditation group. So, out of all those different styles, the physiological psi was a little bit better as far as self-reports, but it also goes to show that all of these breathwork styles were helpful. So, instead of giving you one thing and saying this is the panacea for everybody, I think it's much more valuable to say, find something that resonates with you, that really works, that clicks, that you feel good when you do. And then that's going to have a lot of really good benefits. We have a whole host of research to support this. So, how do we do the physiological sigh? Essentially, it's two sharp inhales followed by a slower exhale. So, it would be something to the effect of. So, what I'm going to do is I'm going to put a timer on for about 2 minutes. And I'm going to encourage everybody just to do 2 minutes of that physiological sigh, and then I'll kind of wrap it up and I'll open it up for questions. So my encouragement would be nasal breathing predominantly when you do this. But if you want to exhale through the mouth, you certainly could. I would not advocate that you inhale when you do it. But we're going to take 2 minutes just in your seat or on your couch as you're doing it right there. And let's do the physiological sigh together. And time. So that's 2 minutes. I think it's important just kind of feel what you feel at that point in time. Some of you may have liked that, others may have appreciate a different type of practice. Again, the take home from this slide and from the others recently is find a breath practice that works for you. If it's the physiological side, it's really easy to do, but it could be box breathing. It could be the 5.5-second breathing. They're working on different elements, but those elements overlap to some degree. So just know that breath work is free. It's your ally. It's something that you can go to at any point that you think it could be helpful for you. And particularly what I would encourage you to do after you've hopefully taken the encouragement that I've given you to dial in your breathing, your mechanics, I should say, is find a breath practice that suits you and then see if you can start integrating it in at least 5 minutes a day throughout the course of a given week or so. So with that, if people are interested, I'll leave this QR code up here. I did a 3 video series of how to breathe in a relaxed way, and then also when your core is engaged. So we didn't talk at all about core engagement. If you want to snap that with your camera, you're welcome to do that. This will take you to, again, a free little mini course that I have. We go over the breathing IQ again. Then we talk about breathing in a relaxed way, in a calm way. And then we get into how do you breathe when your core is activated. So for those of you that are working out or that you want a stronger core, I would encourage you, please make sure that your breathing is dialed in. I'm commonly flummoxed by how many patients that I work with that have been doing Pilates or different things, and they don't know how to breathe when their core is activated. And if that's you, I would encourage you to take ownership of that. And in this video, I'll teach you how to resolve that. So hopefully you snapped a picture if you were going to. Also, if you're interested in learning more about breath work or just healthy age-related stuff, I have a podcast. It's called the Better with Age podcast. You can find it at YouTube, Spotify, Apple. Our YouTube channel is at Better with Age program. There's a whole host of really good interviews on there. This one in particular was great. Rosalba Courtney, she's from Australia. She's a DO. She's a PhD in breathing. She knows more about breathing than anybody living today. She's just a wonderful, kind, generous person. I think I interviewed her at 7 p.m. my time. It was 10 a.m. her time or something like that. It was an awesome conversation. So there's a couple other breathing ones on there, but there's other conversations about blood sugar and different things as well. Just a little bit about Creekside. Breathing is really a fundamental thing that we do, even if people aren't necessarily coming in for that. We just want to make sure that everybody's breathing really well. Our goal is to get to the root of the problem and not just treat symptoms. So our goal is to, again, help you to get the best version of your life from a physical standpoint that you can get with it. So with that, I'm going to stop my share. And I'm going to open it up to any questions. So if people want to unmute and ask some questions, if not, we're at time. I see that we're just over 7:30 here. I appreciate your time. You can certainly sign off, but I'm here to answer any questions that you might have. So with that, I'll open it up.
And we'll also be sending out an email to thank you all for attending, and we'll have some links and some additional information for you. So you can reach out to us that way too. Okay. Well, we thank all of you for joining us. If you find you do have questions and you want to reach out, you can contact me at pam@mnpersonalizedmedicine.com, and I can connect you with Galen as well. You can follow us. Our website is the same, mnpersonalizedmedicine.com, and we will send that email out shortly. But we thank you all for attending. Thank you, Galen. That was really informational. A lot of detail packed in there. Who would have known, right? There's a lot of value in knowing exactly how we're breathing and breathing to our fullest ability. So thank you to everyone. I hope you have a wonderful evening.
All right.
Thank you very much.
Thanks, everybody. Hope it was helpful for you. Reach out
Thank
if you
you.
have questions.
Thank you.
Good night,
Thank you.
everyone.
Bye, Galen.